All right, here at Bloomberg, we've been taking a look, I should say, at the various models Congress could use in creating a new health care plan. Today, we are focusing on nonprofit health care co-ops, and Lizzie O'Leary has more on that from Washington. Lizzie?
Well, Matt, co-ops are seen as a potential compromise here in D.C. They kind of thread the needle between the public plan backed by the White House and private insurance companies.
If you want to understand the co-op model, visit Minnesota's nonprofit HealthPartners. The concept is even in the name, partners.
We don't put shareholders' interests at the top of our list. We put our members' interests at the top of the list.
Members means the 1.2 million people her company insures. They get care at clinics and hospitals owned by HealthPartners. They vote for and even comprise the board of directors.
It's so nice to have your own little vote to say how things get done, and it's important.
Most for-profit health plans average about 6% profit margins. HealthPartners makes about 2%. And that money's all reinvested to fund things like a phone and email consultation system and coordinated electronic medical records.
I think I can take better care of patients when I have better access to the information.
That approach makes the cost of care at HealthPartners about 8% cheaper than at other plans in the state, and about 25% cheaper than the national average. But taking the co-op model nationwide presents a whole series of challenges, including how to get the plan off the ground and how to pay for it. The lead advocate for co-ops in the Senate thinks about $10 billion in federal seed money could start a series of co-ops rather than one national plan.
You do need critical mass, and critical mass appears to be about 500,000 people in a pool to have the negotiating power that you'd need to be successful.
And success, as defined by the administration, means a viable alternative to commercial plans.
Do you think having co-ops on a larger scale would keep, the phrase the president likes to use is, keep for-profit insurers honest?
I think they'd be good competitors for the for-profit plans. Yeah. I think they could be very good competitors.
Now, there are two big things to keep in mind here, Matt. One is time. It took 50 years for HealthPartners to get where it is now. Paul Keckley from Deloitte says, look, we just don't have that much time. Number two is politics. Some GOP moderates have voiced support for co-ops, but a lot of others view them as a Trojan horse for a government-run plan, and they oppose that, Matt.
All right, Lizzie, thanks very much for